Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and we are joined today by Josh. He is the physical therapist or animal physical therapist at Salt Lake Animal Physical Therapy in Salt Lake City, Utah. So thank you for joining us today, Josh.
Of course. Yeah. Thanks for having me. My pleasure.
So I love physical therapy for dogs. 3 out of my 4 dogs are in PT. The 4th one would be if I had more money. And so I know of all the benefits of PT for dogs, and people think that I'm crazy for taking my dogs to PT. So I'm excited to hear your perspective, what you treat, what you see a lot. And let's kind of just get started with, what exactly you do and how you got into it.
Yeah, of course. Well, first off, you're not crazy for taking your dogs to PT. I actually find dog owners will do a lot more for their dogs than they do for themselves. But
Right.
yeah, so I'm a doctor of physical therapy, certified canine rehab therapist. Basically what it sounds like. I'm an animal physical therapist. So I take dogs with all kinds of injuries, and perform physical therapy. So there's different types of physical therapy or different ways people do physical therapy. I think in the 90s is when animal physical therapy kind of started to become bigger in the US, in Europe or Australia and stuff like that first. But yeah, different ways, kind of the old school method is kind of started with underwater treadmill and laser. That was the only thing. And then it kind of has evolved from there. And there's different people that practice different ways. But as far as for me, I do instrument assisted soft tissue mobilization. Sorry, my air conditioner just kicked on. Can you still hear me
That's
okay?
okay. Yeah,
Okay,
you're good.
sorry about that. So anyways, instrument assisted soft tissue mobilization. So kind of everybody's familiar with scraping. Don't get necessarily as crazy as, the humans do with causing, bruises and all that. It's more about neuromuscular stimulation, increasing blood flow, decreasing the tone and tightness of the muscle. Do some cold laser, helps with inflammation, cellular recovery, tissue healing. They're on a pulsed electromagnetic field bed. So it's a PEMF bed. It's just a low-level electromagnetic field between 5 and 15 hertz. Helps with, bone healing, tissue healing, inflammation, arthritis. Do some stretching, range of motion, kind of hands-on manual therapy, joint mobilizations, neuromuscular electrical stimulation. A little bit different than TENS. I don't necessarily use TENS for pain much. I'm more using the electricity to get the nerves and muscles firing in like a post-surgical dog or an old dog that they're just not firing well anymore. Do some strengthening exercises, balance, coordination, proprioception. I also do dry needling. A little bit different than acupuncture, same type needles, and it depends on the state laws, whether PTs can practice that, because there's even some states where human PTs can't even dry needle humans. So that's kind of
Right.
different, depends on where you live, if you have that or not. But just going to release tight muscles, help with like the pinched nerve in the back or different things like that. Releases endorphins and calphins, serotonin for pain relief and nerve function. So pretty comprehensive approach. Every dog's different. We do a thorough evaluation and kind of treat the dog based on their impairments and their needs, and also based on their goals. I'm really big about finding out, why is the reason that this, what's going on? Why is the owner upset the dog's limping? It's not just because the dog's limping, but they can't go on hikes together. And so, treating the impairments, but also treating the dog to get back to whatever their lifestyle needs are and how they want to live with their owners. So.
Yeah. So you do a lot within your practice. I'm pretty familiar with the underwater treadmill,
Yep.
a little bit of acupuncture, although you're doing dry needling. Now, I don't know if we can do dry needling in Florida. I don't know any vets that do it. And quite honestly, even as a human, it's hard for me to find people to dry needle me. So I don't know what kind of like regulations, but I do know personally dry needling for me is fantastic. My dogs are very responsive to acupuncture. And, that's one of those other things. It sounds very woo-woo, and I didn't believe it at first either. But the first time I took one of my dogs to acupuncture, it was when I had a dog with cancer. And I said, man, she's just not sleeping. She's not sleeping. Let me try something different. I took her in, they did the spots, and she came home and slept 8 hours. And I said, there's
Wow.
no way that that worked.
Yeah.
So the next week I went in, I said, hey, she's not eating. Like, I'm almost testing them at this point. She came home and ate a full meal after. And I said, this is the craziest thing I've ever seen. And so now I have 2 seniors that go, and really it's for mobility maintenance. They both have arthritis and they both have some disc issues. And then I have a younger dog. He's got like grade 4 subluxing patellas. So we're actually doing prehab to lead to surgery, and then we're going to do rehab after. So, several things you kind of mentioned. So with that, I think of it as buckets of care. So you've got maintenance, you've got aging seniors, and then you've got pre or post op or pre or post surgery. Do you think those would be kind of the 3 buckets you sort of put PT into?
Uh, That's a good question. I did want to hit on one point you said about acupuncture and dry needling.
Uh-huh.
Both of them are highly effective. I also love acupuncture. I know it's kind of woo-woo to some people because it's Eastern medicine, but super effective. And yeah, I mean, with acupuncture or dry needling, it stimulates the parasympathetic nervous system, so it's gonna cause the dog to be a little more tired, a little more sleepy, and also just help them feel better because it's treating the nerves. So yeah, that's awesome that it helped your dog. Your dog feel better. But yeah, I think those 3 buckets make sense to me. An aging dog, um, pre and post surgery, and then maintenance. I would put, you could be maintaining a healthy dog, or you could be maintaining, an older dog. Like sometimes,
Mm-hmm.
like people do maintenance for their older dogs, especially after they went through PT, because they just love how well they are doing. So yeah, I mean, there's probably a few things that don't fit in there, like the oddities, like a dog that's hit by a car, or
Right.
different things like that. But those buckets make sense to me for sure.
And what do you think you see the most often? Are you seeing mostly seniors, or are you seeing mostly dogs with injuries or surgeries?
I see a wide variety. I mean, I do see a lot of senior dogs with arthritis, hip dysplasia, elbow dysplasia, or just limping, just, slowing down, just need muscle mass strengthening, good neural function. Um, but I mean, what I see a lot of, I see a lot of dogs, and maybe I'm getting too ahead of myself into the next question, but I see a lot of dogs with like CCL injuries, a lot of dogs with IVDD and arthritis. Those are kind of the big 3. But I see all ages of dogs. I mean, I have had dogs up to, 18, 19, 20 years old, but I see a lot of like 2 or 3-year-old dogs, with IVDD, the intervertebral disc disease. It's essentially kind of like a disc herniation or pinched nerve in the back. And certain breeds are more prone to that, like your Frenchies, your Wiener dogs, certain smaller long back dogs, just really small disc space. Humans, we have a pretty large disc space, but when a
Mm-hmm.
dog has an injury and they don't have a lot of space, if there's much inflammation, it pinch on the nerve and lead to paralysis, and things like that. So I see. I have a puppy I'm working with right now that was born with a maldeformed arm, all the way up to like 17, 18-year-old dog right now. So it's really pretty wide range. I wouldn't say the majority are older dogs. I mean, older dogs definitely need it, but I see a lot of younger dogs with injuries too, and everything in between.
Mm-hmm. Yeah, and you did kind of touch on, so, I always like to think like, what are the most common things you're treating for? And so one of them you said is would it be any kind of disc disease? So it would be any kind of herniation, what people might call
Mhm.
like a slip disc. You think that's like one of
Yeah.
the top ones for sure?
Yeah, that's one of the top ones for sure. It's called, they kind of lump it all into IVDD or
Hmm.
intervertebral disc disease, and it's kind of a broad term. It can be, a dog with a slip disc or herniated disc, a pinched nerve, or even a dog that's getting arthritis that just has a narrow space, and so now that nerve is pinched. So yeah, kind of any back injury is kind of lumped into that, and then also the cranial cruciate ligament tear, which is essentially the same as a human ACL tear. That's very common in dogs. It's typically like more degenerative. It's not as much of a like traumatic twist, plant and twist type activity. It can be, but in dogs, it's just kind of more degenerative over time. And then of course, arthritis as dogs age and just kind of stiffen up and need more, muscular strength. A lot of people may think, oh, there's not much you could do for arthritis, but really keeping the joint moving doing range of motion, getting some fluid in the joint, getting some strength around the joint to support that structure, and then just make the dog more comfortable, and they could just move better and feel so much better and just have a lot better function. So there's actually a lot you can do with a aging dog with arthritis. Yeah, one of my favorite things to work with is intervertebral disc disease, just because it's really sad. A dog, if they have from T3 to L3, the third thoracic vertebrae down to down the back, they'll get paralyzed in the back legs. But if it happens in the neck injury, they can be paralyzed in all four legs. And I see some dogs post-surgical for that. Sometimes they have surgery, but I see a lot of dogs that don't have surgery for that for various reasons, whether the owners don't want to do it or it's pretty, $8,000 to $10,000 surgery, pretty expensive. And so I work with a lot of dogs like that, and it's just super rewarding to see them from, going from not being able to walk again, and just really cool to see. And also just, to support the owners. It's pretty emotionally disturbing. Like, I've seen hundreds of cases, but I realize each time it's the first time for them. So
Right.
just being able to support them and, help them through that. And sometimes it's about helping the dog, of course, but also just supporting the owner and, and their emotional needs and what they're going through. So.
Yeah, and I think sometimes we get caught up as owners with traditional vet care. And this isn't me hitting on any vets or, the profession, but unfortunately sometimes you're told your dog has a particular issue or, some kind of paralysis, and they say it's permanent, it can't be fixed, there's nothing you can do.
Hmm.
And while that might be true, I think, practitioners like yourself are certainly offering an option, maybe a solution. It doesn't hurt to
Hmm.
try it. And so I think that that's really great. And I love that this is growing and more dog owners are becoming knowledgeable about um, these different modalities that are available. And you mentioned, keeping the joints moving as dogs get older. As our friend Bo would say, motion is lotion. So
Hmm.
he always says
Yeah.
motion is lotion for anyone. He's always talking about, you got to keep things moving if you want them to continue to move.
Hmm.
So that makes sense. So let's say that a dog owner's listening and maybe they don't have a diagnosis, but they are seeing their dog slow down. Maybe they're seeing them limp. Are there signs and symptoms that you can identify where an owner should try PT?
Yeah, definitely. First off, if the vet can't help, it's a good time to try PT. And going back to the IVDD thing, not to bash any vets or anything, but I've heard plenty of stories of, do surgery or put your dog down in 3 days or this dog will never walk again. I've seen
Yeah.
plenty of them get better. So, it's just, the vets are really good internal medicine and really good animal practice, but sometimes a further comprehensive rehab evaluation or treatment is needed. And so, yeah, definitely if you're not getting the answers that you want with your vet, it may be a good time to consider PT. And usually most vets are pretty open to that. Other things is like, of course, like you said, if your dog's slowing down, if you're just seeing little signs, like maybe they're struggling to jump up or struggling to go up the stairs, if you're noticing they're starting to lose muscle mass and, especially in the hind limbs is where you see it, or even in the spine, seeing the bones a little easier. If they're not playing with their toys like they used to, that could be a sign of pain. If you see them struggling to get up, yeah, if you see them even sometimes not eating well, definitely go to your vet. If a dog's not eating, you need to have your vet check them out. But like sometimes I've had, dogs that are in pain and they come in and we do PT and they're getting better and they're like, all of a sudden my dog's eating again. They weren't eating well. So yeah, just, it's always funny. People are always like, your dogs can't talk to you, but really they can. Like if you pay attention to their behavior and their signs, and I tell people that when they come in, like, yeah, your dog can't tell you if they're feeling better from PT, but you'll see the signs, one day they're going to just
Right.
jump in the car again, or, they're going to be able to go up the stairs again, or they're going to start playing with their toys or do things that they used to do that you thought they would never do again.
Hmm.
Which, sometimes we just chalk it up to aging. But, lots of times, there's pain and other things involved that can be addressed so they can kind of live their best doggy life or have a full quality of life and do the things they love to do. So.
Hmm. Now, is there something you see owners do or allow their dogs to do? And maybe it's something you've seen repeatedly and you wish that owners would stop doing it. Like, does anything come to mind for you that's preventable that you see regularly?
Oh, I've thought about this question and it's a tough question. Definitely let your dog be a dog, but I'd say in the case of like IVDD, that's what comes to mind. Like, if you have a Frenchie or a wiener dog or a dog that is more prone to that issues, like, maybe them repeatedly jumping up and off the bed or up and off of the couch. Not the best thing for a dog like that. That's lots of times how you see a French bulldog or a Dachshund like become paralyzed is like that impact. So if it's a
Hmm.
smaller dog that's prone to issues like that, maybe jumping up and down off the bed all the time, things like that isn't the best thing. I'm not saying you can't do it, but just be careful and be aware of what your dog's needs are and what they may be prone to. Um, yeah, and then I'd say don't be afraid to get help. Like, if you do see these signs, like, sometimes I wish I saw a dog like a year earlier, a few years earlier. I guess one thing that does drive me a little nuts is after surgery, lots of dogs don't have PT, like after a
Hmm.
CCL surgery or various other surgeries where a human doctor would be like, yeah, go do your PT after ACL surgery. Now that's
Right.
just common practice. They're starting like day one pretty much even in the hospital, and getting that quad activating, working on range of motion. And that's, I think, one big thing I see is after a CCL surgery, and I get that it's expensive and people probably don't want to pay for PT after that. But I just see, some dogs do okay, but I see some dogs that are, oh, they're putting weight on it, they're walking again, that's good, but like they're not going to get the full range of motion, they're not going to build up strength and get back to full function. So I'll see dogs like that 6 months later, a year down the road, a couple years down the road,
Hmm.
where I feel like if they just would have addressed the issue initially and kind of got full strength, full mobility, full function, worked on balance, coordination, proprioception, done all the things that are necessary after a surgery like that to regain full function, then they would be a lot better off. Just because your dog's putting their weight on it and walking in doesn't mean they have full strength and that, it's going to be the best functioning leg forever. So I think that is one thing that I would encourage is like if your dog has a surgery, like, even a luxating patella or,
Hmm.
CCL surgery or any of those orthopedic surgeries, like I would highly recommend that they have PT afterwards because it's really no different than a human.
Yeah. Yeah. We are about to schedule what's it, a TPLO. And
Yeah,
so it's going to be his back legs. And so we will be doing PT probably same week as surgery. We're going to jump
yeah,
right in. We're doing some prehab stuff right now just because that knee comes out so easily. Just working on that strength, already trying to like kind of build up those muscles, making sure everything structurally is as strong as it could be before we go into our surgery. And obviously, a cruciate tear is a concern at this point. We're worried the longer we wait until surgery, something can tear, then we make it even worse. And so I'm an advocate for obviously everything that you're doing and all of your modalities. Um, so, where can people find you
yeah. No, that's awesome
on?
that you.
Oh, sorry. I think there's a lag time.
Oh, you're
Sorry.
fine. I was just gonna say it's awesome that you. Yeah, no worries. It's awesome that you mentioned prehab because that's what a lot of professional athletes get prehab before a surgery. It's just common for them. Unfortunately, athletes usually get the best care, and prehab is amazing. Building up those strength, building up the muscles, and everything beforehand, and they're just going to recover so much better after surgery. So I think it's awesome that you mentioned that.
So I know you're out in Salt Lake City, Utah. So where can people find your website? Where can people find you on social media?
Yeah, we're Salt Lake Animal Physical Therapy.com. So Salt Lake Animal Physical Therapy.com. I have, different links on there. You can find our email, our phone number. I have, my website's kind of user friendly for clientele and there's different like phone consults or different free guides or different things you can download there. And quick side note, I actually have people like reach out to me from like the East Coast, from Ireland. I just helped a guy with his dog in Ireland with advice, and so just all over. It's kind of crazy how people can find you online these days. But also at Salt Lake Animal Physical Therapy on Facebook or Instagram. So it's just at Salt Lake Animal Physical Therapy. You can follow us there and or message me there as well. So
Awesome. Well, thank you so much for giving us some of this information. Hopefully, it helps one of the listeners with their dog, whether it's an injury, arthritis, whatever it might be. But we really appreciate your time.
awesome. Thank you. Thanks for having me. And yeah, if you guys have any questions, feel free to reach out. I'll definitely get back with you. So.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.